No doubt about it. Don't doubt the AARP, right? The probably most influential special interest group, which is Part D, is the big winner from the Inflation Reduction Act. In Jay's corner on the newsletter, it's here. I went bigger than the headlines, which, the main headline has been, well, Medicare should be able to negotiate with the drug companies. That for me is not really the big one. What I did here is, you've got a bunch of different details on the Inflation Reduction Act. What I did here is I rearranged them in timeline order because the different aspects have different effective dates. Right? So when am I going to start getting this stuff? When am I going to start getting this stuff? When does it take effect? As opposed to, the politicians, parading around waving a victory flag. Here's how it's going to affect individual consumers. Next year, right away, these three first bullet points. Vaccines at zero. So it's not only COVID. It's not only monkeypox. Still not entirely clear what monkeypox is, largely because I don't spend time clicking around too much. But in addition to that, for the Medicare crowd, this also importantly means shingles. Shingles not well covered, generally speaking, under Medicare Advantage or Part D plans. Now it is. It appears to be inside of Part D, meaning that you can't just skip out on it, Part D, and the late enrollment penalty. You still need to have a Part D or have prescription drug benefits inside your Medicare Advantage plan. 2023 vaccines at $0. Shingles, expensive, because usually you need two, each $200 plus, $400. Told you it would start right away. Second one gets big headlines because diabetes is a national epidemic. Insulin capped at $35 copay. This is also going to be a very welcome change because now every Medicare Advantage plan that has a prescription drug benefits, MAPD, or a Part D plan will have this for all insulin. Now, I was asked by the media, okay, what does this mean for the rest of the plans in the future? And it's too early to tell, and any speculation by me here would borderline be reckless. And generally speaking, as most people would know, followers would know, I'm not all about reckless speculation. Speculation within some bounds is, warranted. In fact, I have speculated to some degrees on what changes could happen in Medicare, and in fact, many of them have come true, like the fact that Plan C, Plan F, and or Medigap no longer exist. The first edition actually made that statement that I wouldn't be surprised at all. Under here, somebody's going to say, okay, well, what's going to happen to Part D premiums? What's going to happen to Medicare Advantage plans, et cetera, et cetera? And this is what I would call still to be determined. Because a lot of the money that has come to superior insulin coverage today has come from the federal budget, which has given money to the Medicare Advantage carriers. I'm not sure how this will be affected going forward. You could say that the allowance could be lower in the future. Why? Because the federal government is going to be covering the insulin benefit via the Part D plan. And so the question is whether or not who's going to eat this, where's this money going to come from, isn't well settled as far as the details that I can see so far. I'll have an update, that's not for today. No question though, type 1 diabetics, people who do rely on insulin lower. And now you can understand why I started this talking about the AARP. Because while I stated that this is definitely the case, the provision to include the $35 insulin copay inside of the ACA failed. It failed. Only the AARP one. Only inside of Part D does the insulin copay limit of $35. Now, there are certain states, I want to say Colorado being a notable example, where the state by state has also like basically layered on top the extra provision inside the state. That will depend on the state, but that can exist. But for federal Medicare, insulin capped at $35 starting right away here in just a few months' time. Time flies when you're having fun. I can't believe it's the end of August. Crazy. In addition to that, 2023 price increases here. Medication cannot exceed inflation, but the difference will be sent to Medicare, not to you. Okay, so this one is not as big for me. For me, this is not as big. Meaning that the inflation, the price of the medication can't exceed the inflation measure. Let's call that 8.5% in a year. But the fact of the matter is you're not going to see a lot of this because of the fact that that's going to be in the weeds of your Part D or Medicare Advantage plan. And the difference has to be sent from the pharmaceutical company to Medicare. So you aren't going to see it even if the medication were increased. And then on top of that, you're going to have competition to push prices down on top. So this one for me isn't as big. As we go to 2024, we continue on here, and now we're going to have some structural changes to the way that Part D actually work. It's this first one. I'll stop playing around. Stop playing with my food here. This first one, which is the catastrophic stage. Right? If you hit the catastrophic stage, which is currently $7,050, then your cost will be zero. So let's quickly review. If you've maxed out above the catastrophic end, then you're charged 5% or a fixed copay for generics. Starting in 2024, once you hit the 70-50, then it stops, you pay zero. Now, we're going to have even bigger development in 2025. We're about to get to it. So during 2023, it's status quo. During 2024, you're going to have a maximum of $7,050. From then, you pay zero. Now, in addition to that, you have Part D premiums can increase by a maximum of 6% a year. This will not have a large impact. I still think that this is true, which is while there's going to be a cap, and I do expect, by the way, I do expect that you will have the 6% because all the moving parts moving around is going to be pretty dramatic, right? The sum of all of these changes is going to be fairly dramatic. So if call it reckless speculation by me, but yes, I would expect that the only possible way to make all the numbers fit is, in fact, for Part D premiums to go higher. That's my guess as of today, subject to change based on further detail. The big one here is this third one, 2024, which is Extra Help Expanded, which is currently set at 130% of the federal poverty level. So, inside of Maximize Your Medicare, and I'm going to go to it now. Let's just see here. I'll show it to you here. Inside of Maximize Your Medicare, inside the website for the book, is Medicare info. This tab here. If you go in here, what I've included inside the website for the book, which is available at Amazon. I have to add that. Inside here is Apply for Extra Help Part D. And what it is this is the federal location. It's a link to the federal location administered by Social Security. So, real quick, extra help is administered by the federal government, not the state. Federal. So it is entirely possible for your state to reject you, but for you to qualify for extra help. It's important to know this distinction. Okay? There are people who don't qualify for Medicaid, but they do qualify for extra help. And if you do, you should get it. It is big. It's big for a lot of reasons. Number one, your premium lower under Part D. Number two, your copays fixed at known numbers that override everything. It's really important here. These are points that I don't think get proper attention except in my favorite book, which happens to be Maximize Medicare. But my point is that sometimes you're going to choose a Part D plan because of the fact that you think that the copays are going to be different, or because on your Medicare Advantage plan, because of the prescription copay. But there'll be some other aspects of a Medicare Advantage plan, especially, that you like in a different plan. Well, if you made your decision on prescriptions alone, or primarily so, and now I told you, no, that's not the reason that you would decide amongst Medicare Advantage plans, you then change to across Medicare Advantage plans. That is the right outcome. That if you don't know that it's fixed. That's just part of it. The reality is the big news here, the big thing that people also don't understand about the extra help. If you qualify for extra help, then your late enrollment penalties for Part B and Part D are waived. Not only today, but in the future. And so now I can't put us in a time capsule for the past. But if you qualify for extra help, now it's not only will you have the lower copays for the deductibles and the lower premiums, the 2 points that I mentioned just a moment ago, but in addition to that, the late enrollment penalties are then waived. And this is big. For those persons who, for example, they worked for a city or local government where they didn't pay into Social Security, so you didn't get the right number of credits for Medicare, which is entirely a possible scenario, a common one. Common. People will know somebody that have this, in which case you have not accreted the right number of credits. So as a result, you have to pay for Part A, for example. Now those late enrollment penalties, and as a result, you didn't buy Part B correctly, or for whatever reason, you didn't read Maximize Your Medicare to avoid the late enrollment penalties. You get hit with the late enrollment penalties. Here's a side door out. It's completely legal. It's also not well known. Those things included here inside of the Inflation Reduction Act. Let's go to 2025. This is the big one. 2025, as you can see here, bold here in the middle of your screen, which is a $2,000 cap for out-of-pocket costs for prescription drugs. So Part D will have an embedded, all Part D will have an embedded $2,000 annual cap. The ripple effects, again, here are, well, there's the obvious, right? Which is now, instead of having some unknown mystery number on what your prescription drug cost would be in the future, it is now fixed at a higher number for persons on tons of insulin or very, very expensive new new age medication, tier 5 medications, you can't wait for 2025. It can't come soon enough, right? Because now you don't have the mystery and you have a fixed number. So now you can understand back to why the rest of the topics on this channel, right? For comprehensive financial planning clients, this is going to be big, right? For those persons who have bad health or ones that rely on expensive medications. Now all of a sudden you can plot this orange line, which has healthcare costs, your out-of-pocket healthcare costs, which are different than insurance. But your out-of-pocket costs can now be lower, way lower, and less variable. Both. It's not only level that matters. It's the fact that it's not going to move up and down. So as a result, that is going to help a great deal of people here on the orange line, irrespective of whether or not you actually rely on very expensive medications today. The very fact, even if you were Mr. Perfect today at 66, you're worried about what happens when you're 71. Well, now all of a sudden, okay, now you think through, okay, what happens when I'm 71? At least I now know that my medication cost will be capped at $2,000. It's one less thing to worry about at a known number. Very, very valuable. So I'm keeping my eye on the clock here. I've used the 30 minutes. And so now we're going to move forward here as I finish this portion with the last point. Now only here do we come to what has gotten the headlines, which is the negotiation by Medicare. So starting in 2026, which seems like, light years away, Medicare will negotiate with the drug manufacturers. I don't think that this is huge. That's my own personal opinion. It's optics. The optics are great. No question about that. Right? Medicare negotiating the price of 10 medications. And then 15 in 2027 and 20 in 2028. It's like a litany of tongue twisters here. The list is determined where Medicare has spent the most money. That's not well defined, first of all, right? And in addition to that, we are hearing or seeing little snippets of pushback from the pharmaceuticals. Given the fact that this is in 3 years or 4 years, 3.5 years, 3.25 years, I guess I should say, I'm going to leave this to the side, right? Because we don't know what those medications are. We don't know if the thing actually is successful. We're not sure what the mechanism by which the negotiations are going to occur. So we don't have really the set of effects. For me, this is still what I've put it up here in bold. This is the one. Because not only, like I said, you've got a lower number, and in addition to that, you'll have a cap. This fundamentally changes the way that what used to be known as the donut hole, which I have renamed for my own purposes, the coinsurance gap, right? Because you get a 75% discount, you're responsible for 25%. That now also then has a cap at the $2,000 a year. Huge for this exercise here as I help those persons plot their course towards retirement. It just could not be bigger. Yeah, I get asked, I get asked in the national media. Here's my quote in here. This is thestreet.com. Miss Gillespie. Anything longer than 2 or 3 letters, I'm very subject to making an error. Anyway, here's my quote down over here. Yep. Ding. So this is back to the elimination of catastrophic stage, a clear win. And the reality is that agreed by a PhD at T. Rowe Price, etc., etc. The data doesn't show what the exact size. The reality is that I don't think that this mattered. That the but he denoted that the data doesn't show what the exact size is. That to me, the reality is I'm going to disagree here. It matters. It matters irrespective of the size because of this. So for me, I'm going to still stick with my original point, which is that this running the show. Absolutely.